Good afternoon. I'm George Latimer, Westchester County Executive. I'm joined by Deputy County Executive Ken Jenkins, and this is Thursday, June 3rd, our weekly coronavirus update report for Westchester County. We are now having one report a week. Today's report takes the place of what would have happened on Monday, which was a holiday, Memorial Day. And starting this coming Monday, June the 7th, we will have Monday reports and give you an idea of where we are as the weekend ends and as the week begins. We are seeing a tremendous drop now in the extent of the infection. We're very encouraged by that. We know we're not out of the woods yet, and there are any other number of other things that could yet happen that could change the circumstances. But we want to be as transparent as we can. We have a dashboard that's updated on a regular basis that you can access through our website, and we figure that a once-a-week report now is an appropriate amount of taking your time and energy and effort to let you know where we stand. The tracker numbers are in for today from New York State. That is where we get our data from. All of the reporting entities report to the state of New York, not to the county, not to the local governments. So whether it's on the testing side or on the vaccination side, it is New York State that has that information. And they put it back out in a tracker that everyone can see. It reports at this point that we have 129,420 cases of coronavirus in the aggregate from the very beginning of this pandemic in March of 2020. And 129,018 of those cases have cleared the 2-week interval. That means that as of today, we have 402 active cases of coronavirus in Westchester County. That number is the lowest number that we have had during our tracking and recording during these reports that we've been doing since April of 2020. The prior lowest amount came the very first week of August of last year, where we got down close to this area of 432 cases. But now at 402 cases, we have the lowest amount since we had that great rapid increase in cases that occurred that week in March when we first saw the virus extend. To put it in very specific terms, yesterday we had 9 positive cases of coronavirus in Westchester County, and 5,137 tests were administered. 9 positives out of 5,137. I think it's pretty clear that the amount of positive spread of this disease now has been dropping dramatically, and we're in, quote unquote, a very good place. The percentage is much lower than anything we've seen before, and in the aggregate, we have tested 2,900,000 individual tests have been administered. Now, obviously, many of them are multiple number of tests per individual. We have roughly 1 million people in Westchester County, so on this average, you'd see almost 3 tests per person. But some people have been tested much more frequently because of their employment. Some young people have been tested more frequently because of their involvements in schooling and athletics and so forth. We're also encouraged by the fact that there were no overnight fatalities in Westchester County last night to COVID, and we have lost only 1 Westchester resident over the last 4 nights. And we're hoping very much to have a week with only as little as 1 fatality. Every fatality is a tragedy, but we hope not to have the second fatality. And if we can reach a point at which we've gone a whole week without a fatality, a continued dropping number, we'd be very excited. The last hospitalization number we have is as of Monday, 37 people are hospitalized for coronavirus. That number is also extremely low. And I've often pointed to the mid-January numbers that are now 4 months, almost 5 months ago, where things were peaked after the holiday season, where we had 588 people hospitalized, down now to 37. That's all very encouraging news. The vaccination side of the equation is clearly the reason why we've had this result. We have vaccinated in our 4 major locations 415,990 vaccinations administered. And the county center, of course, has been going gangbusters since early January. They're approaching 300,000 vaccinations administered. Our clinics, smaller environment, 56,000. And the Yonkers Armory site, which went offline a few weeks ago, had done 71,500 when they went offline. There is some discussion as to whether or not that is going to come back online. It really depends on decisions made at the federal level, FEMA, and at the state level to determine whether Yonkers Armory will come back. I think we pretty much realize that we're at a point now where the supply of the vaccine is plentiful, and a person who wants a vaccine does not have to drive to the far reaches of New York State to get it, that a vaccine is just a short hop away from wherever you are. What we're facing now, we talked about it when we were earlier in the year, and now we've reached that point at which most everybody who wants a vaccination has received it, and therefore the people that are still unvaccinated are because they do not choose to be vaccinated. There may be some small number of people that can't take the vaccination for whatever personal health reasons they have now. We know that some percentage of our society falls under the age of 12, and no vaccines have yet been authorized by the Food and Drug Administration as appropriate to be administered to children under the age of 12. Within the last month, we received authority to administer Pfizer vaccinations for 12, 13, 14, and 15-year-olds, and most recently, the county's vaccination efforts have moved towards satellite or pop-up locations at various school settings. I went to one in New Rochelle High School, and the week before Dobbs Ferry High School. Ken has gone to a number of them as well, and they've worked very well. They're not the same level of volume that we had earlier in the vaccination process, so we're not getting hundreds upon hundreds of people. But those people under the age of 16 that are now eligible with parental or guardian approval are now getting vaccinated. That number is what's probably the greatest increase in the number of people vaccinated. At this point, the information that we have tells us that over 60% of the county population has received at least one vaccine dose. And that means within the course of the month, those individuals having received their second dose will be fully vaccinated, and that number will be in the 60 percentile range. We are in the 50% range of all of those who are fully vaccinated. That means over half of Westchester's population is fully vaccinated. So when you see many contexts now where people are not wearing masks, the expectation is that those are the people who are fully vaccinated. If you are fully vaccinated, we've been through this before, you now have the freedom to move about with less restriction from masks. However, there still are some requirements for mask wearing. I'll cover those in just a second as we touch on a few other points. But I do want to note that we're very encouraged that if you look at the population that's 18 years of age and older, there we have hit 73% of the eligible population. And so all of these are good numbers. Vaccinations on the rise, the infection on the decrease. One of the reasons why we're going back to once a week updates, because we want to keep you posted, but we don't think we need to commandeer unnecessary time to cover all of these things. I do want to mention masks just for a second. Masks are still required in certain settings as mandated by the governor through his executive order authority. On public transit, trains into the city, Metro North trains in the city, if you're in the city on the subway or bus system, out here in Westchester County on the Beeline bus system, you must wear a mask as a passenger at all times. Doesn't matter if you're vaccinated or not, you must wear a mask on mass transit. It's also required in nursing homes, in homeless shelters, correctional facilities, very importantly in schools, and in other healthcare facilities across the state. These are guidelines that have come down from the feds and the state, so our job as a county government is to administer them and to make sure that you are mask wearing in those particular contexts. Private venues can still regulate as they see fit. They can require a mask for you to enter their establishment, or they do not have to have a mask requirement. That's entirely up to the individual situation. It's generally advised if you are immunocompromised, if you have one of the diseases that affects your immune system, things like AIDS or cancer, you would be advised to continue to wear your mask. And if you are unvaccinated, you need to wear your mask and socially distance, because if you are unvaccinated, you still are very eligible to get the disease. Whether it affects you seriously or not, you can pass that disease on to other people. And even those of us who are vaccinated, the vaccines are highly effective, 95% protection rate, but nothing is 100%. So we have to be sure that we're making that last little bit of protection to make sure that we avoid getting the disease as best as possible. We have gone a long time. This is a long period of time. We have gone with restrictions, wearing masks, socially distanced, Zoom meetings instead of in-person meetings, the economic impact that that's had on certain businesses and certain industries. We're this close. Why not ride it out to the end of the situation? We may be very close, perhaps during the summer. The more we open up, given the warm weather, the less we're indoors, the more our activities are outdoors. The governor's lifted a number of different restrictions. We're opening playland. We've already opened the beaches. We will be opening the pools. All of these things that are coming up, playland and the pools are coming up at the end of the month. All of these things are signs that we're trying to return to normalcy. We want normalcy. We want people to live and function the way that we did back in February of 2020. But we have to do it within the context of being safe, because we don't want to see a reignition of this pandemic again. We saw it last year when things went down of their own accord, and then they started to spike up again. But we didn't have vaccinations at that period of time. We do have vaccinations now. So we think hopefully that's the game changer. I'm going to ask Ken to cover the vaccine passport update, which will be helpful to understand how the state is looking at the Excelsior Pass program. And then we'll have a couple of other non-COVID related topics to cover. Ken.
Thanks, George. The Excelsior Pass, the COVID-19 Vaccination Pass, had some modifications from its initial rollout. Over 1 million people, at least in the state of New York, have downloaded the Excelsior Pass. It's extremely helpful when you're going to the events and to the locations that County Executive Latimer just mentioned, whether it's a theater, whether it's a sporting event, et cetera, that you have that vaccine pass eligibility and open on your phone, on your smartphone, and certainly help those folks that need that assistance to get it on their phone. But the Excelsior Pass has been updated. When it first came out, it was only good for 90 days because at that particular point in time, the CDC said that the vaccinations were only eligible to be, you were only covered for 90 days initially. More data came in and the modifications changed, and now they're saying that with the initial sets of vaccinations, you're good for at least a year. They're still working on those variants, as the county executive mentioned, but right now the vaccine pass has updated to a year. You have to do some things differently. You have to go to the application on your smartphone, and in your smartphone it's under the New York State wallet. Go into that particular thing and delete that existing pass, and right on the same screen, you can go and download the pass again. The pass is not eligible. You won't see a pass availability to you as an individual, ask you some questions to identify yourself. You will not see that pass of eligibility for 2 weeks, until 2 weeks after that second shot for Moderna and Pfizer, or for Johnson & Johnson 2 weeks after that total dosage has been given. So now you'll see it a year. So my particular pass was originally eligible from September 21st, 2021, and now I'm good until March 25th, 2022, and we'll see what happens as we go along the way. If you've had problems trying to download your information into the Excelsior Pass app, you may need to go to the place that you had your vaccination initially. If you cannot do that, the Department of Health has an email address that we're putting up on the screen right now that will show you and give you some direction to assist you in getting your vaccine pass downloaded to your smartphone device. It's very, it's easy, but it's hard at the same time, because if there's anything that's different, whether you gave one email address on your first shot and a second email address on your second shot, or there's a particular date that's a problem. We have had that information happen for some of the pharmacies that you have gotten your vaccination in Westchester, but their corporation headquarters is in Putnam, and those kind of things will throw everyone for a loop. So again, make sure to go back to your place that you got your vaccination at to assist you. But our Department of Health at the email address has been helping individuals out as well to straighten that particular problem out. You can also call New York State, the state database for vaccination records. We're putting that particular telephone number up on site as well. It's 518-473-2839. And all of these are assisting in the tool, the Excelsior Pass, which is an excellent tool that you can utilize, again, if you're traveling or if you go to any of the venues. Some places require it, and it's very helpful and it's easy to get downloaded. However, make sure to take the time to update that particular pass, because it does not automatically update. Thanks a lot, George.
Thank you, Ken. Thanks very much, Ken. So on a few non-COVID related issues, I've mentioned that we've opened our beaches, although last weekend was not a prime beach weekend, but we have two beaches, Playland Beach on the Long Island Sound Shore side, and the Croton Point Park Beach, which is over on the Hudson River side. Both of those beaches are now open Friday, Saturday, and Sundays through the end of the month. However, we need lifeguards. So if you're 15 years of age and older, and if you think that lifeguarding is for you, it's it's a fun employment. It's part-time employment over the summertime. Generally it's a social type of job. You're outside, you're getting tanned, if that's something you want to do, and you have a chance to interact, obviously, in a way with people to help them, to save lives, if that's called upon. Lifeguard trainings were brought to a halt during this pandemic, but the County Parks Aquatics Division is ready to work with you on this. You must be 15 years of age or older. You must possess a current American Red Cross lifeguarding first aid equivalent or certificate, and you have to pass a Westchester County practical skills test. If you like information on this, that's the smartest thing to do. Go on and look at it now to our website. You can go westchestergov.com and find some further information. I think we have some of the website's information and email addresses to follow so that you can get the information on the aquatics team and help us out, because we need your help. We want to staff these 2 beaches, and we're still in dialogue with the state. We're hopeful that we may be able to bring Glen Island Beach online. There's no promises. It is not a definite. Do not tell somebody. I heard George Latimer say this because he didn't say that. He said we're working on it, but we're working very closely with the state to try to convince them that we can manage around the use of Glen Island as it has been as a testing site. And if we get authorization, we open that up. That's our largest beach, and it serves the southern portion of the county. It is a complement to our pool system, which will open up at the end of the month, where we have Wilson Woods Pool down in Mount Vernon, right over the border from Pelham, and we help solve and satisfy the needs of that section of the county as well. And of course, Glen Island is easily accessible from the New England Thruway, so all the way up through Port Chester is a possibility. So consider becoming a lifeguard. We could use that assistance, and there are other part-time jobs for the summer that are available. By all means, take a look, and we'll see if we can be helpful to you. We wanted to identify that we've got a major public policy issue that is on our doorstep, and that is emergency rental assistance for those people who have not been able to pay rent for economic reasons due to COVID over the course of this pandemic for the 14 months or 15 months, I always seem to lose count, that has gone on since then. There will be a large number of people that are subject to eviction. And New York State, federal government, Westchester County want to be helpful to those individuals. The state has created a New York State Emergency Rental Assistance Program. We always have acronyms for this. That's ERAP, E-R-A-P. And as of June 1st, Westchester County residents are eligible for this program. You may see some of it publicized on TV that involves New York City as well, because New York City, Nassau, Suffolk counties, along with Westchester County, have all linked in to the state program. If you're behind in rent, there is help. $20 million has been earmarked for Westchester County households alone for those people who are at risk of eviction and due to their inability to pay rent and utilities because of the COVID pandemic. This does not cover people who were in eviction status before the pandemic came down. These are for people who had jobs, and by dint of losing their job, losing their income, they were unable to pay rent over the course of this period of time. The payments will be made directly to the landlord or the property owner and to the utility company, not made to the individual tenants, made directly to the landlords in order to solve the arrearage. And the landlord agrees not to evict with that, but that does make the tenant's requirement to resume payment of all rent and other responsibilities as part of this process. And the landlords also make certain agreements as part of all of this. The ERAP program can provide financial assistance for up to 12 months of past due rents, 3 months of prospective rental assistance, and 12 months of utility arrears payments to eligible tenants, and that's regardless of their immigration status. So the application process is at hand. If you are in this situation, if you are behind in your rent and you fear eviction, call 211 on your phone, 211. That is a helpline that's operated through our work with United Way of Westchester Putnam, and the people who you speak to on 211 can direct you to one of the non-for-profit organizations that will assist you in being able to apply for this money. It is not a process that you want to try to do by yourself, and you do not want to avoid taking action, because you need to act now while this program is available. These monies will not be available forever, and you want to solve the problem now, and we want to prevent the eviction as we can now. So dial 211 if you're in this situation. You'll get more information that way, and hopefully it will get you back to stability. And then once you're back to stability, as I said earlier, back to normal, we can then resume a normal life after that. We also want to highlight that tomorrow we're going to be celebrating Pride Month. June is identified as Pride Month. The LGBTQ Advisory Board and county officials will be raising 2 Progress Pride flags, say that 3 times fast, Progress Pride flags at Playland Amusement Park, and also a mural that was painted by the loft in front of the Playland fountain. We'll be doing that tomorrow morning at 8:30, bright and early, rain or shine. and the mural unveiling right at the Playland Fountain, right at the entrance of Playland Amusement Park. We had, a year ago, raised the pride flag here at the county office building. We have scaffolding going on and work being done. So some of the ceremonies that happen here at the county office building will be moved out to other locations around the county. Every year we celebrate Irish Heritage Month in March. We celebrate Italian American Heritage Month in the month of October. We do similar respect for other ethnic groups or organizations. And so in the month of June, this we will do as well for those in the LGBTQ community. We want to show that Westchester is a united family. We are different. Every one of us is different in our background, in our demographics, our religious beliefs, a host of things that make us different. But we have strength and unity. That's why Forward Together United is the way we view this, that we are stronger because we are diverse. That gives us a greater opportunity to face the problems from the pandemic to the other issues that we have to deal with, and recognizing all of those differences and showing respect to those different traditions is what we try to do, as we do with other ethnic groups. So this month, the LGBTQ community is front and center. The events tomorrow will highlight that for the county, but there are other events in other communities. We're well aware of other communities that are also raising the pride flag, and we think that is a wonderful thing. Just a weekend ago, we had Memorial Day, where we honored those who gave the ultimate sacrifice, and we had a Westchester County program, terrific program at Lasden Park. There was a dedication of a bridge for Sergeant Joseph Lem in Harrison, West Harrison, White Plains, and almost every community had some sort of ceremony over the course of the week. And I attended ones in Cortland and Mount Kisco, Mamaroneck, and a host of other communities. Ken handled a group of them. And this, too, is honoring our veterans community, and not just with symbolism. We're very close now to having raised the thresholds for eligibility for veterans tax exemptions, which will allow more veterans who've served, whether in wartime or peacetime, but in the military of the country, to access those reduced tax benefits. So we're looking at Westchester in its entirety, and we want to see this not as a situation of us and them and the other. We want to see us as a unity situation. That's what's made Westchester terrific all these years, and that's what we want to continue going forward. So tomorrow we'll honor the LGBTQ community, and we will continue to take those kinds of actions in the future with all of our different ethnic groups to show that solidarity. So we'll check to see if we have any questions. We have no questions from the remote. If anybody from the press is observing this, they can contact Catherine Chaffee, 995-2932. Any questions that follow this report? We did have a press conference outdoors a couple of days ago in which we invited the press to attend because it was an outdoor setting. Whenever we're doing these reports indoors, we're very comfortable with the press accessing information through the feed, asking questions in this fashion through Catherine. We'll try to answer any that are germane to the topics at hand. So we will see you again on Monday at 2 o'clock for the next update, and then all the Mondays thereafter. If we have a Monday holiday, which we will, the 4th of July week, and then again later on in the year, Labor Day, if we're still doing this by September, we'll advise what other day that week we'll be giving the update. But look for us this coming Monday. We'll be with you to give you the latest update. The numbers have been very good. We hope they continue that way. We hope you continue safe. If you have not been vaccinated, it's the right thing to do. You should think about it twice, and see if you can cross that threshold. It's good for you. It'll be good for the people around you. I'm George Latimer, Westchester County Executive. Thank you for watching. Stay safe. Have a wonderful weekend, and we'll see you on Monday.